Hey everyone, welcome back to Digital Health Live at CES 2014. I've got a super cool guest. We had an awesome panel. It's called the Radical Hospital, super amounts of innovation. We got Shiv Gaglani, who's the curator and editor of Medgadget. How you doing?
Good, how are you?
So I'm a big fan. I read Medgadget every issue.
Really? No, that's great. We're pretty prolific. I mean, we have a great team of physicians and engineers who write for us.
So what brings you to CES this year and what was going on in the panel?
Great. So I was asked to moderate the panel on Radical Hospital for Medgadget, and also because I'm a curator of something called the Smartphone Physical. And the purpose of the panel was to think about what does the future of the hospital look like? Because I mean, everyone goes to everyone has been to the hospital at least once, like when you were born at least, and not many people have great experiences there. And there's certain innovations that Digital Health Summit's covering that I think are going to penetrate the hospital and make our experiences a lot better in the next 10 to 20 years.
Can you drill down on that?
Sure. So I'm excited about things like big data with, IBM has Watson, and there's also something called Isabella. We just had a demo from Orlando Partali where he was using Google Glass to link up to Isabella so that a doctor could just be wearing the glass and then narrate to the glass what the patient's symptoms are and then get a differential right there. Watson can do similar things and really empower clinicians to deliver care in a much better ways.
Great. So you're working on some interesting projects. Tell me about Osmosis.
Sure. Osmosis is a medical education tech startup that another friend of mine in med school and I both co-founded. And the whole point was to train the next generation of clinicians. And we, have you ever heard of learning by osmosis?
Yeah.
Right. That's the whole point. We're trying to get clinical students to learn and retain information more efficiently, and also expose them to some of the Digital Health Summit's type of technologies so that they can be early adopters and really move medicine forward.
Are you using like video and multimedia, or what's the platform look like? What's the experience?
No, that's a great question. So we have a web platform as well as a mobile app, and there are about 6,500 medical students around the world right now who are using Osmosis, the iOS app, and we're delivering push notifications to them with questions and resources, images, mnemonics, even articles, and that's what we're really excited about, really empowering this next generation of clinicians to be the best they can be.
Where are we at with super radical technology in the hospital today? And where do you see it coming up in the next 3 years?
I think in the next 3 years, I'm hopeful that it'll go from maybe 5% of hospitals being innovative to hopefully closer to 15 or 20% trying to be more innovative. There's some really cool technologies. The problem with hospital technologies is oftentimes they're meant for marketing more than they are for outcomes. And by that I mean everyone wants the newest surgical robot or newest whatnot without actually realizing that, and then they have to recoup their costs that they put up for that. So they aggressively expand, and it's too much. And so I'm a medical student at Johns Hopkins, as I mentioned. I'm really excited about some of the cheaper and more evidence-based technologies that we're often looking at the Digital Health Summit.
How do people follow you and find out more information about Medgadget?
Sure, Medgadget's easy. It's at Medgadget. I'm at Shiv Gaglani, my name, and then Osmosis is at Osmosit.
Nice, Osmos IT.
We've made it a verb, right? Nice. Google it, Osmosis, Osmos it.
All right, cool. Well, hey, thanks for being on the show, and we'll see you. What are you doing next?
Going back to Philly and continuing work on Osmosis.
Cool. We'll check it out. So thanks, and we'll see you next year.
Yeah, it was good talking.